What does an X-ray show to differentiate OA from other arthritis? Imagine trying to solve a puzzle where each piece reveals something about the disease. X-ray images are like that puzzle, helping doctors tell osteoarthritis apart from other types of arthritis. When you look at an X-ray of someone with osteoarthritis, you see some clear signs. The most noticeable is joint space narrowing, but it's not uniform. It happens unevenly because cartilage wears down in specific areas. Along with this, bone spurs called osteophytes from around the joint edges. These are the body's way of trying to stabilize the damaged joint. You might also notice increased bone density beneath the cartilage, known as subchondral sclerosis, and small cavities called subchondral cysts may appear inside the bone. These features tend to show up in joints like the knees, hips, hands, wrists, and feet, depending on the person's age and activity level. Now, when doctors want to tell osteoarthritis apart from inflammatory arthritis like rheumatoid arthritis, they look for key differences. The most important is the absence of erosions on the X-ray. Erosions are irregular holes or damage in the bone's surface, which are common in inflammatory conditions. If erosions are present, it suggests rheumatoid arthritis or other inflammatory types rather than osteoarthritis. Osteoarthritis typically shows osteophytes and joint space narrowing without erosions. In contrast, inflammatory arthritis often has erosions but fewer or no osteophytes. Doctors also use grading systems to see how severe the osteoarthritis is. Early on, X-rays might show slight joint space narrowing and small osteophytes. As the disease progresses, joint space becomes more narrow, osteophytes grow larger, and sclerosis gets worse. In the most advanced stages, you see big osteophytes, severe joint space loss, and sometimes deformities in the bones. Getting clear images is important, so X-rays are taken carefully. For knees, weight-bearing views are best because they show how much space is actually available when standing. Multiple angles help see all parts of the joint and catch any changes. Sometimes, if the doctor needs more detail about soft tissues or early cartilage damage, an MRI might be ordered. But for initial diagnosis and distinguishing osteoarthritis from other types, plain X-rays are the go-to tool. They clearly show the pattern of joint space loss, osteophyte formation, and the absence of erosions, making it easier for doctors to identify osteoarthritis confidently.